Hey class, back again with another installment of chapter 14. We're moving on to objective 3, and in this objective we're going to explain bipolar disorder. So without further ado, let's get to it. Bipolar disorder you've heard about. It is depression plus mania, and mania is kind of a hyperactive state with very little sleep, and generally the person feels very good. They feel very happy. They feel very elated, on top of the world, euphoric, however you want to call it. The depression and the mania cycle in bipolar disorder, thus the word bipolar, two poles. Genetics does increase risk by quite a bit, more so than depression, major depression by itself. So we do see a higher genetic involvement there. In terms of treatment for bipolar disorder, we use an old drug. It's really an element on the periodic table called lithium. And lithium is very effective, but it does, again, have some side effects like all of the older drugs tend to have. Valproate, or also known by the trade name Depakote a lot, and carbamazine, those are drugs that were previously drugs used for epilepsy, which are now used for bipolar, and they seem to be pretty effective. All of these drugs, the three of them, all decrease AMPA receptors, which are glutamate antagonists, because when they knock out those AMPA, then glutamate can't be as effective. And so that indicates that maybe what's going on with mania is that there is excess glutamate excitation. So maybe you have too much glutamate there in mania, but we really don't know. We're just assuming that because this is the way the drugs work. The drugs do, however, also block inflammation in the brain. So it may be that inflammation in the brain is the problem, but just like with depression, we don't really know why these drugs work, but they do tend to work in many patients anyway. All right, let's move on to objective 4. We're going to explain the genetics, neurodevelopmental aspects, and brain abnormalities of schizophrenia. Okay, well, first, what is schizophrenia? It's a disorder, a mental disorder, which is quite debilitating, and it affects about 1% of the population, and this is true throughout the world. It tends to affect thought, emotion, and movement, so it really affects the whole of who a person is. The symptoms vary quite a bit from person to person. There are positive symptoms, and those symptoms are things you gain as a result of having schizophrenia, for example, like hallucinations or delusions. And then there are also negative symptoms, which is things you lose as a result of getting schizophrenia. So, for example, you may lose social interaction. You may start to keep to yourself and isolate and things like that. You may stop talking. That would be a negative symptom. The brain damage varies quite a bit from person to person with schizophrenia. We see mild to moderate brain damage. We don't tend to see real severe brain damage, but I'm going to talk about some problems in the brain. In the onset, oddly enough, it tends to happen in young adulthood. So it doesn't happen when you're very young. It tends to happen around 18, 20 years old or so. And it's a little bit later for women. Men are more likely to get the disorder. It comes on earlier, and it's more severe in men. So there's some kind of sex-linked characteristics there. Okay, well, if you look at genetics, we do see some genetic causality there, and some of that is just based on the idea that monozygotic twins or identical twins have higher concordance, meaning they're both if one has schizophrenia, the other one is likely to have schizophrenia more so than the dizygotic twins, which are the non-identical twins. So there we see if you're 100% genetically similar to a person with schizophrenia, you're quite likely to get it, as opposed to if you're only 50% genetically similar. So that tells us that genes are involved. It's not one gene. It's probably a whole bunch of genes. It's probably really complex. There are also environmental influences that are really important there, many of which we really don't understand. But it's not all genetic, but genetics definitely play a role. Okay, let's talk about the neurodevelopmental hypothesis. This is the idea that the child gets some brain damage early in life, and I'm talking in utero, okay? But it doesn't show up until after adolescence. Now, the reason being is that some of these brain areas are not entirely mature until adolescence. So if they're not being used, even if you got damage, you're not showing the damage if you're not using that part of the brain. So those parts of the brain that mature late are the parts that seem to be affected. And there we see that again in the frontal lobe. Okay, well, there are also some prenatal abnormalities that may turn out to be causes of this brain damage in utero. And so what we see is people with schizophrenia tend to have a large number of birth complications. That can be things like low birth weight, bleeding, problems with the mother, diabetes, preeclampsia, things like that. Problems with the baby in terms of breathing and other kinds of risk factors early in the pregnancy. We also see that mothers who are Rh negative in blood type and infants that are Rh positive, because the mother's blood type differs from the baby's blood type, there we get the mother exhibiting some immune reaction. And that immune reaction becomes stronger and stronger and stronger with each baby that is different. And so because she's building antibodies. And so we see a greater incidence of schizophrenia when we see those blood differences. There's also a season of birth effect. People who are born in the winter have a higher risk of schizophrenia. And we think that that is possibly due to a viral infection of the mother during pregnancy. And so that can happen from the flu or basic things like that. And they always tell you to get a flu shot. If you're pregnant, you have to get a flu shot. Here you see that seasonality of schizophrenia. Most people, or a lot of people with schizophrenia, will have been born in those winter months, presumably because the mother had a fever that made schizophrenia more likely. If there is a genetic predisposition, because again, there's a genetic issue there. Okay, another possible candidate for the causes of schizophrenia is a parasite called Toxoplasma gondii. And that is a parasite that is carried by mice and by cats. And people get it generally through cats, and particularly cleaning cat litter boxes. And people with schizophrenia are more likely to have toxoplasma antibodies, meaning that they've been exposed to toxoplasma. And they'll tell you if you're pregnant, don't clean the cat's litter box for this reason. But it's not for sure, because not all who get it get schizophrenia, probably because they have to have the genetic predisposition. And not all people with schizophrenia have Toxoplasma gondii. So it's not, necessary, certainly for schizophrenia, but it may be one of those possible causes. We see some brain abnormalities in schizophrenia. We see that ventricles are larger, meaning there's less brain and more fluid-filled spaces. The thalamus is smaller. We see lower activity in the left parietal and temporal lobes and in the left hemisphere in general. We see an inactive prefrontal cortex. There are hippocampal abnormalities. There's disorganization of the neurons in the hippocampus. We see in general a low activity in the left hemisphere. They're more likely to be left-handed, which would indicate a dominance of right hemisphere. Many studies, however, have found no significant differences in the brains of younger and older patients. So we can assume that schizophrenia is not a progressive brain disease, but instead you get the brain damage when you're very young, and then it just kind of comes out, the effects of it as you get older. Okay, here we see that low prefrontal activity here in the person with schizophrenia versus the normal activity there. Okay, so again, we ask ourselves this neurodevelopmental hypothesis: what, if the brain damage occurred so early, why do these symptoms show so late? What's happening is that some of these areas, like the dorsolateral prefrontal cortex here, is an area that tends to develop very slowly. So again, if the damage is there because of in utero damage, when the mother was pregnant with the baby, the damage still doesn't show because that brain area hasn't been put into use until the person has the brain fully developed. We'll move on to some other hypotheses about schizophrenia in the next video. You guys have a great day and see you later.